Actually, it all starts from a digitized slide. That's what you see in the bottom of the screen. You have a slide with a number of specimens being put up in being state. The digital flow really starts with smart object extraction. Why is that important? Because it can already focus your attention to the places where you need to look. And if you can actually cleanly extract your objects, it largely facilitates the treatment of the objects afterwards, and it's also already a quality control step that you can build in at that point. Now, when you end up with a nice full resolution image of the object that you're interested in, the digital flow in AI can help you in a number of different ways. A typical one that you see is what you see on the top right corner, is AI can help you to segment and to do calculations on your image. In this format and in this example, what we've tried to do here is to quantify and separate all the cyst formation in a kidney. What you see there is that all the yellow is what you at first pass would suspect to be a cyst, and then manually can actually select these objects, exclude some of them, and do a calculation. And their AI really becomes your companion as a pathologist to work. The other one example on the left side is an example of picking up cell nuclei, which is one of the base activities, I would say, in any pathology evaluation. Nuclei are the bread and butter of the pathology practice. So actually here the algorithm has tried to pick as clean as possible the individual cells and nuclei, which allows you to either assess their presence, but more importantly, to do quantification, to count them, to look at the size, to compare areas with, for instance, a large nuclei versus normal nuclei. So all these options actually are facilitated by the algorithm that actually does the hard work, is selecting and separating the nuclei. The two other examples I've put here are a little bit, I would say, more sophisticated. The dream, I would say, of any AI system is on the bottom right. It's where you can match actually a text report with your images. That today, I must admit that we're certainly not the only ones. We cannot do that out of the box today, but nobody can, because it takes a lot of effort not just to work with the images, but also to be able to understand text, not just words and letters, but to understand the meaning, the dictionary, the terminology that's being used in pathology reports. And my colleague pathologists can certainly confirm that it's not an easy language. There's easier languages to learn than the language of pathologists, even for a computer. And the other example, which is also something where AI opens the doors, is that by comparing similarities in images, and that's what you see on the left downside, the computer can help you to look for images that are similar or that have similar features or similar observations into the image. The way AI can help you do that is that by pre-digesting the image and finding clues or fingerprints in the image, it can make this search through this vast database of information much faster and much easier. And that's one of the, I would say, most hot and attractive items within the current evolution of AI within pathology, is that to better classify and search images would be a major gain in accessing information across the globe.